Greetings, students. I am Marcus, and I welcome you all once again to Online Assignment Bank. It's been quite a while since our last installment, and we truly appreciate your patience. Your ongoing thirst for knowledge and dedication to improving patient care is what drives us. We have been busy behind the scenes, researching and compiling accurate, comprehensive content to ensure we bring you the most relevant and up-to-date information. So, without further ado, let's dive back into our series with our latest topic, pre-operative care. So sit back, take notes, and as always, we are here to assist in your journey to becoming even more remarkable healthcare professionals. Let's get started. Pre-operative care is a crucial step in the healthcare sector, ensuring patients are well prepared for surgery. So, let's delve into a case study to explore nurses' knowledge in delivering this crucial service. Our case study involves a 76-year-old woman with a complex medical history, including osteoporosis, prediabetes, and depression. After suffering a fall, she was admitted to the emergency department. We have dissected this scenario in 5 parts, as you can see on the screen aforementioned. Firstly, we need to identify the patient's risk factors that could influence her diagnosis. This includes her advanced age, pre-existing medical conditions, and the impact of her recent fall. Secondly, we will delve into the pathophysiology of osteoporosis. These 2 conditions are needed as understanding how this condition weakens bone structure will help us comprehend the patient's increased risk of fractures and guide our pre-operative care strategies. Our third focus is on identifying additional nursing assessments needed for holistic, person-centered care in the pre-operative period. This involves evaluating the patient's mental health, lifestyle factors, and ensuring appropriate pain management and nutritional support. The fourth part takes us into the realm of legal considerations. Here, we ensure that all the procedures adhere to the guidelines of informed consent, safeguarding the patient's rights and fostering trust. And lastly, we address ethical issues related to privacy and confidentiality. It is essential to respect the patient's personal information and ensure her privacy is upheld throughout the process. Having established a solid foundation with the case study, we now shift our focus to the next critical component of our analysis: how to craft an academic project based on this case study. There's a chance that you may be asked to work on a similar theme in your course, which means this exercise could give you a head start. Your newfound familiarity with the topic could streamline your work process and potentially contribute to a higher score in your semester. To prepare an academic project on this topic, we'll start by collecting data from reliable databases like PubMed, Embase, MBDLINE, NCI, and AHL. Keywords such as osteoporosis, role of nurses in caring for patients with fall, legal and ethical issues, privacy and confidentiality, and pre-operative period can help us narrow down the search. We will then organize the data into a structure that answers the 5 critical questions asked in the introduction. This will help us assess the different aspects of pre-operative care and the role of nursing in this context. Lastly, pay attention to formatting. Include a cover page with all relevant details. Use a 12-point Arial or Times New Roman font, 1.5 line spacing, and a minimum of 2.5 centimeters margins. Don't forget to include page numbers and your student ID in the footer. And that's it. This was the brief overview of the nursing curriculum, pre-operative case study of a 76-year-old woman, and how things can get tackled easily. As we conclude today's session, remember that understanding pre-operative care is not just about textbook knowledge. It's about the thoughtful application of this knowledge, ethical considerations, and a commitment to holistic patient care. By exploring this case study and envisioning its application in an academic project, we have embarked on a journey of deeper understanding and empathy. So let's carry these lessons forward in our pursuit of excellence in healthcare. Until next time, stay curious and continue learning.